And I'm here at the studios of KALW for part 2 of our interview with Wendell Potter, author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. Wendell Potter spent 20 years working as a senior public relations executive for two of the largest for-profit health insurance companies in the U.S., Humana and CIGNA. But in 2008, his conscience got the best of him, and he left his job as a well-paid corporate communications executive for CIGNA. So what did it, Wendell? What happened?
I'm from Tennessee, and I went to visit my folks a couple of years, actually in 2007, and I picked up my newspaper, and I saw that there was this big expedition that was being held a few miles up the road from where I grew up at the Wise County, Virginia Fairgrounds. And I went there, and I was just stunned with what I saw. I knew that we had a lot of people who didn't have insurance in this country, but I thought of them in numbers rather than individuals and real people. I couldn't do that after that experience, because when I got there, I saw hundreds and hundreds of people who were lined up in the rain, in lines that stretched out of view, and many of them were waiting to get care that was being provided free by doctors volunteering their time in animal stalls. They were treating people in animal stalls and in barns and under tents that were open-sided. I could wander around and see people being treated. And it was just incredible. It looked like it might have been a war-torn country or something absolutely surreal, maybe a third world country. It was just, I could not believe that this was the United States of America. The folks from Canada who say that we have the best healthcare system in the world, I'd like for them to come down and stand in a real line to see how so many Americans have to suffer and not have access to the care they really need.
Well, if you have money, it's easy to believe that the U.S. has the best healthcare in the world because you can buy whatever procedure it is that you need.
And that is why the myth has been perpetuated that we have the best healthcare system in the world. We have many good treatment facilities,
right,
some of the best in the world. There's no doubt about it. We also, though, have one of the most inequitable healthcare systems in the world. On a measure of fairness, we rank behind Bangladesh.
So moving forward, this is going to be a long fight. And we're talking public relations and spin, healthcare, military, economics, tax cuts, you name it. Yeah. And there's a machine behind it spewing out these talking points. Yeah. How do you fight this?
Well, you need to be aware of how it's done. And that's why I wrote the book. You have to start with awareness. You have to know your enemy. You know how to know their tactics, and you have to fight fire with fire, in my view. You have to understand how they play the game. They set the rules, and you've got to understand that, and you've got to figure out how you can counter what they're doing. And I think those of us who understand it, we have numbers on our side, numbers of people, of individuals. We don't have maybe the financial resources that they have, but we can create legitimate grassroots organizations. They have to create fake ones.
Do you think that in our or your lifetime we will have Medicare for everyone in the United States?
I actually do, because I think that we've seen the health insurance industry change radically over the last 15 years, 20 years definitely. It's going to change radically again. And I think we will see the day that investors will say, this is not the best place for us to get a good return on our investment. They'll move their money elsewhere, and I think the for-profits will do something else. And hopefully we'll get to a place where at least maybe in the interim we'll have our healthcare system once again dominated by nonprofit organizations.
Now, to many of us, healthcare is just a human right. But to many, it's not.
Right.
And I just want to put you on the spot for a minute. If you had to, let's say you had an audience of people who are very skeptical of Medicare for All, saying it can't work, it's government, we don't have the money, it's government takeover. How would you sell it to them?
Well, you have to understand where they come from and what makes them think the way they think, and where they come from culturally. Some people you can talk about the economic message or better than you can that it's a right. Many people just don't believe that. They think that they've pulled themselves up by the bootstraps, and other folks are just irresponsible for not getting coverage on their own, for example. They don't see this as a right, and we just need to accept that a lot of people don't hold that view. So you've got to understand how to communicate with them in ways that resonates with them emotionally.
And what's next for you?
I'm going to be doing more writing. I'm going to be becoming a journalist again. I'll be writing commentaries and analysis pieces and continuing to speak out.
And you can find Wendell Potter's writings right under this video. He's author of the new book, Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. Wendell Potter, thank you so much, and thank you for speaking out.
My pleasure. Thank you.
Thank you.